Macular degeneration, or MD as it's sometimes called, affects our central vision. Our central vision allows us to drive a car, read, recognise faces, see colours clearly and any other activity that requires fine detail vision. 1 in 7 Australians over the age of 50 show some evidence of macular degeneration, but it is not a normal part of ageing and should never be ignored. In its early stages, it may not cause any visual symptoms, but as it progresses, it can lead to distortion, fuzziness, and ultimately complete loss of central vision. In fact, macular degeneration is the leading cause of legal blindness and major vision loss in Australia. It should be noted, however, that macular degeneration does not produce total or black blindness. The front of your eye comprises the transparent outermost cornea, the iris, the pupil, and the lens. Light comes through the front of the eye and focuses the image onto the retina, which lines the back of the eye. The light-sensitive retina captures images which are then sent via the optic nerve to the brain, which interprets them and allows us to see. The macula is the area at the very centre of the retina at the back of the eye. It's responsible for detailed central vision and most colour vision. Macular degeneration is a disease that affects a special layer of cells in the eye called the retinal pigment epithelium, or RPE for short. The RPE is like a wall that separates the retina from its main blood supply, a vascular layer called the choroid. The major role of the RPE is to nourish the retina and remove waste products. In between the RPE and the choroid is another layer called Bruch's membrane. In early macular degeneration, waste products called drusen build up underneath the RPE. These yellow spots are what an optometrist or ophthalmologist would see when examining the back of the eye for early signs of macular degeneration. Having drusen doesn't necessarily cause visual symptoms, but it does increase the chance of vision loss occurring later. This is why having your eyes tested and macula checked is so important. As it progresses, MD has 2 forms. The first is dry MD, which generally results in a gradual reduction of central vision over many years. In its final stage, which can produce severe vision loss, even blindness, dry MD is known as geographic atrophy. The other type of MD is called wet MD, and it is aggressive, sudden and severe. Here, choroidal blood vessels break through Bruch's membrane and rapidly grow under the retina. The vessels may even break through the RPE as shown here. This leads to leakage and bleeding, which without treatment causes scarring and rapid loss of central vision. It is important to know that dry MD can turn to wet MD, so vigilant monitoring of MD symptoms is crucial. On the Macular Disease Foundation's website, you can order an Amsler grid, a simple tool to monitor for symptoms of macular degeneration between visits to your eye care professional. But it does not take the place of an eye test and macular check from your optometrist or ophthalmologist. And it's worth noting that if someone in your family has MD, there is a 50% risk of you developing the disease. For a copy of an Amsler grid or more information on ways in which MD can be slowed down or treated, please contact the Macular Disease Foundation on 1800 111 709.